We are outside the Pottstown Hospital today. It's a beautiful day, and I'm here with the CEO of the Pottstown Hospital, Rich Newell. How are you doing today?
I'm doing well, thank you.
Good, good. So I wanted to start by asking you, how does the Pottstown Hospital view what's going on with the pandemic right now?
It's very concerning. We've been on a roller coaster of emotions and stress over the past 18 plus months. You know, we were one of the earliest hospitals to see a COVID patient back in March of 2020. And, you know, we didn't get hit too hard by the first wave. We got slammed by the second wave.
Really?
And now we're starting to see a little bit of a tick up of COVID again. We went about the past 4 or 5 weeks without a single COVID patient in-house. We were feeling good about things,
Yeah.
but with the Delta variant, things are starting to pop back up. And it's very controllable, but we are seeing an uptick of COVID patients again on the inpatient side.
Okay, yeah. So have you noticed an increase of cases in the Pottstown area, and would you attribute the Delta variant to those recent cases?
So that's a tough question, because really the only way to identify the Delta variant, it's by the CDC. So if it's shipped down to Atlanta and they identify it, then we know it's a Delta variant. So some things are being sent down there, but it's very easy to look at Montgomery County, which of
Okay.
course Pottstown's part of, and there's a huge uptick. In the last 30 days, we went from under 2% of of new COVID cases, and we're up at 11.1%.
Wow.
So if you're under 5%, you're managing the virus pretty well, and that's where we were for the first part of the summer. But now that it's starting to tick back up, 11% has the county officials and really all of us a bit concerned. Now, Pottstown itself, all I can speak of is what's happening in our emergency department. And we are seeing a number of patients coming in with symptoms and testing positive. And as I mentioned earlier, there is the uptick of inpatients that are coming in, but we're still single digits. I think today we're at 3 or 4 inpatients with COVID. So I would say yes, because the Delta variant is being identified in Pennsylvania and in Montgomery County. But again, it's hard to put specifics on that. What we do know is the Delta variant is very contagious, and it is impacting not just the older population, as what was thought with the original COVID virus, but now we're seeing younger, like late teens, 20s, 30s, 40s. That's what's making up our inpatients. It's not the 60s and 70s and 80-year-olds.
Interesting. Okay.
Mhm.
So you said your hospitalizations are around like 4 or so today.
Mhm.
Do you expect that to increase with the Delta variant?
Well, that depends on our population. The people that we are seeing that are being admitted, 98% of those individuals have not been vaccinated. The patients that we are seeing who have been vaccinated that are testing positive, their symptoms usually are not as bad. So if we can get above that 70% threshold for individuals getting vaccinated, I think we can be in control of our own destiny. This is not a political issue. This is just a matter of science. And when people ask me the question, should I get vaccinated or not, I'm really not the one to answer that, but I'll tell you what I did. I looked at the smartest people I know in the field. I looked at our infectious disease specialists. I looked at the information coming out of the journals and the science, and I talked with our physicians. And of our medical staff, when the vaccine became available, almost 100%. In fact, there's only one physician I know that did not get vaccinated for her own personal reasons, but everyone else got vaccinated. And when I talked to the infectious disease specialists that we have here at the hospital and other ones throughout the area, they're all vaccinated.
Yeah.
I'm vaccinated, I got my wife vaccinated, I made sure my parents got vaccinated, and my children are vaccinated, the ones that are old enough to be vaccinated. So again, back to your original question, I am fearful of what the trends are showing, but yeah, we can control it if people would just take the vaccine.
Yeah. So with that being said, how important can you stress that it is to get vaccinated?
Again, it's a personal decision, and it's not my place to tell someone what to do, but I make the analogy of polio. And you don't hear about polio anymore because the vaccine was out and people took the vaccine, it was mandated, and all kids got it before they went to school, and now it's very rare to hear about polio. The flu shots, you know, it's very commonplace to get the flu shot, and you know, we didn't have any flu this past year per se because one, people taking the flu shot and all the social distancing and masking that was going on with the
Yeah.
pandemic. So I think personally it's very important to be vaccinated for the protection of not just yourself but those around you. And I'm going to put a plea out to those that aren't vaccinated. Do it for my staff, because they come to work every day and put themselves in harm's way, and they take care of the people that come in that have COVID, and they have families that they need to go home to. So if you're not going to do it for yourself, do it for the ones that are taking care of you and taking care of this community, and doing so every day and putting themselves, like I said earlier, in harm's way. It's an incredible commitment that this staff has, and they didn't waver throughout the whole pandemic, and I couldn't be prouder of the work that they do here. And we're very blessed in this community to have the hospital right here and this dedicated staff to take care of them.
Yeah, that's really great. And the last thing I wanted to ask you was, what are your thoughts on the youth getting vaccinated?
Well, I told you, I feel strongly about it.
Yeah.
In order to get back to some sort of normalcy with schools and sports and socialization, it has shown to be safe. I have a 17-year-old daughter, a 15-year-old son, and a 7-year-old son. The two older ones are vaccinated. As soon as they were eligible, they got vaccinated. Most of our leadership here that have kids are in the same boat. My kids didn't suffer any side effects. I still have them masked when they're in groups, because that's the whole thing. You don't know who is and who isn't. But I think it's very important, and I think it's important that the research come out to show, all right, 12 and above, but what's the difference between an 11-year-old and a 12-year-old? Not much. So let's get some research on the 11-year-olds, and when that gets set up, well, then let's look at the 10-year-olds. Again, it's a very personal decision. I just ask that people make informed decisions. Don't go based on what you're seeing on YouTube or Twitter or Instagram or TikTok. Go to the science. And it really is just a matter of science, and it is incredibly safe. Millions of people have been vaccinated with very few side effects and issues. So, yeah, I mean, if you ask me, it's the responsible thing to do, if not for yourself, for everyone around you.
Yeah.
And that's the only way we're going to get back to normal in this country. That's the only way we're going to get our businesses back, and that's the only way we're going to stay safe.
Yeah, definitely. Well, thank you so much for talking with us today.
It was
I
my pleasure.
appreciate all of your insight.
No, thank you for taking the time to talk with me.
Thank you so much.
Have a great day.
You too. Our journey took us over to Red Hill today, where I'll be talking to Senator Bob Mench about what's important right now. Hello, I'm here today with Senator Bob Mench. How are you doing today?
Very well. How are you?
Good, good. It's a lovely day. And I just wanted to ask you a little bit about the infrastructure bill. Are you excited about the possibility of this passing?
You know, yes, in many respects, I think it'll be a very positive thing for the state of Pennsylvania. Infrastructure has been ignored, or at least well underfunded nationally for a very long time, and our highway system needs a lot of upgrade. You can't have a good economy if you can't move goods and people.
Exactly.
And we have too many crowded highways, we have too many bridges that are in some state of disrepair. We have intersections that need improvement. So there are a lot of things that we need to do about the infrastructure from a construction perspective. I think there are other things that we need to do to facilitate the flow of traffic. Just as simple as coordinating traffic lights in a town like Pottstown.
Yeah.
So that people are stopping less and traffic flows better. You know, a number of years ago, there was a group here in Montgomery County that did a study. It was contractors and business people that were shipping goods every day. And Shelley Lumber did a study, and they estimated that with the trucks that they had, it was costing them $1 million a year stopping at traffic lights and then stop and go. That's a significant cost to a company. So it really does impact the economy in so many ways. And one would argue that it also affects the environment. So let's let's spend this money, but do it wisely. Infrastructure needs to be spent on infrastructure. That's the one thing that concerns me with the way the federal government is negotiating right now. Their definition of infrastructure falls into many different political interest areas. And I think for it to be effective and to give us, the taxpayer, the biggest bang for the buck, it's got to go into just infrastructure, traditional infrastructure.
Yeah, that definitely makes sense. I know you just listed so many positives of what would happen with this bill, but what do you think, if you had to pick one, would be the biggest positive for the Pottstown region?
Again, infrastructure brings economic development. Pottstown is situated very close to 422 and other corridors of transportation. The improvements that could be made there could have a huge benefit to the economy of Pottstown. Pottstown continues to be a great place to establish new business, to be able to expand. We have a willing workforce there. We have reasonable housing, affordable housing there. We have access to so many good services, the hospital, shopping, and so forth. So I think we need to expand the transportation access to the area itself.
Yeah. Well, that sounds great. I know that's a very exciting thing for all of us.
Yeah.
And to switch the topic, I wanted to ask you a little bit about the COVID vaccine.
Yes.
And if you don't mind, can I start by asking, are you vaccinated?
February 22nd was my second shot. Yes, I am vaccinated. I never, myself and my chief of staff, we didn't take a day off from the moment that the governor declared the emergency, because our constituents had so many needs, so many questions, so many issues, not the least of which was early on it was business waivers, and then it was unemployment compensation. It remains unemployment compensation, still a horrible mess. But we had to be here to answer the phones and to be able to talk to the people in the departments. Now, they were working remote, but they were working as well. Whereas Lisa and I were both here in the office every day. And then we were out and about to the extent that we had to be. So I felt it was critical that I get vaccinated, because we didn't know a whole lot about the disease at that time, and it was very transmittable. So and at the senior age that I am, I thought it was important that I get vaccinated.
Yeah, definitely. And for those who aren't yet vaccinated, would you encourage them to do so?
Oh, yes. Yeah, I think so. And you know, we have some people concerned about maybe a little bit about the health issues. I think the bigger issue is the economy. You know, I'm getting emails, no more lockdown. We can't let this COVID, because it's spiking again, we can't let it create more lockdowns. Well, the best way to avoid the lockdown is for us to get vaccinated. And that's the economic impact that vaccination has. We can get out and about, go to business.
Keep the businesses open.
Keep the businesses open, be able to commune with friends and relatives and so forth. What the heck, there's a life improvement here. And it's not just about avoiding COVID, it's also about moving the economy forward.
Yeah, well, definitely. Thank you so much for all of your insight today. I really appreciate it. It was great talking with you.
Well, thank you. It was good to meet you. Best of luck in your career pursuits.
Thank you so much.
All right.